Korean hand therapy. Why can it be a solution to sports injuries and concussion? This may be something you have never considered before. Based on decades of my clinical experience with Korean hand therapy, I will explain why I believe this is the case. What will I consider in this introductory video? I will begin with introducing myself, and next, what is Korean hand therapy? Why is Korean hand therapy so powerful? Here, I will talk about two main reasons that explain why Korean hand therapy is powerful. Then, why is Korean hand therapy particularly effective for sports injuries and concussion? Here, you will hear a few things that must be new to you, but may be of great interest to you. This will be followed by some cases for acute and chronic sports injuries and concussion. Lastly, I will briefly mention how to use Korean hand therapy to manage sports injuries and concussion. Let me briefly introduce myself. I studied Korean hand therapy directly under its founder, Dr. Yu, an Oriental medical doctor. I also trained under Dr. Kim, who was the most skilled hand therapy practitioner at the time. I've been practicing and teaching Korean hand therapy for about 40 years. Today, my focus is on sharing my knowledge and clinical experience with athletes and sports professionals because I believe Korean hand therapy offers a unique and practical approach to managing both acute and chronic musculoskeletal conditions. More information on myself is found here on my website. What is Korean hand therapy? Korean hand therapy is a therapeutic system developed in Korea in 1971. It treats the whole body by stimulating specific points on the hands. It is based on the principle that the entire body is reflected or corresponds onto the hands. So every organ, joint, muscle, or any other body part has a precise corresponding point or area on the hands. You will get much information on Korean hand therapy here on the official Korean Hand Therapy Association's website and on my website. Let me show you the Korean hand therapy chart. As you see here, each hand represents the entire body. The palm corresponds to the anterior of the body, while the back of the hand corresponds to posterior of the body. For example, if you have low back pain, you can find the corresponding tender point on the hand here. Stimulating that point helps reduce the pain here. Likewise, if someone had a concussion here, you can find the corresponding point somewhere here that is used to improve concussion. The same principle applies to other parts of the body. Key features of Korean hand therapy is highly effective. We quite often see immediate results, especially for sports injuries and concussions. Safe to use. There is no side effect or any danger. Easy to learn It is very easy to learn hand therapy, handy to apply. You can use it anytime, anywhere, just using hands. Not only healthcare professionals, but coaches, players, athletes, and fighters can learn it and use it for others or themselves. Unique. Hand therapy is not known to most practitioners around the world. Why is Korean hand therapy so powerful? Many wonder hand therapy is so powerful. Why? Over the years, I have figured out 5 reasons, and the first 2 reasons explain a lot why. The number 1 reason is explained in this picture called the brain map. Here shows high concentration of neurological connections between the hands and the brain. As you see here, about 80% of our brain is directly connected to the hands. So stimulating the points on the hands has a direct effect on the brain and in turn the relevant part of the body. The second reason is direct stimulation on the target area. In clinical practice, the best place to treat a condition is often the site where the problem occurs. For example, in the case of a concussion, the injured area here would ideally be the primary focus of treatment. But in most modalities, direct intervention at the exact site of injury may not be possible. As the entire body is represented on the hands in hand therapy, however, we can easily locate the corresponding point for the affected area on the hands, as you see in the picture on the right here, and improve the condition by stimulating that point with hand therapy tools. This principle applies broadly across musculoskeletal and other conditions, whether it is sprained joint, lumbar pain, groin pain, plantar fasciitis, etc. Korean hand therapy is particularly effective for sports injuries and concussion. To explain why, I'd like to introduce a key concept from Korean hand therapy, which is based on traditional East Asian medical history. From a conventional musculoskeletal perspective, symptoms such as pain, swelling, tingling, and numbness may result from tissue injury, inflammation, nerve dysfunction, and other physiological processes. In Korean hand therapy, however, these symptoms are viewed primarily in terms of 2 pathological factors: blood stasis and qi stagnation. The first illustration shows the free flow of water through a pipe, representing the free flow of qi and blood. When qi and blood flows freely, the body functions normally without pain or other abnormal sensation. The second illustration shows a partial blockage in the pipe, representing qi stagnation. The third illustration shows a complete blockage, representing blood stasis. According to hand therapy theory, sports injuries and concussion create blood stasis and qi stagnation in the affected area. These become the primary factors contributing to symptoms such as pain, swelling, and restricted function. In general, acute sports injuries and acute concussion are considered to involve more blood stasis, whereas chronic sports injuries and post-concussion syndrome tend to involve more chi stagnation. This concept may be unfamiliar to you. However, I have found it to be a practical framework for understanding and treating sports injuries. By identifying whether blood stasis or chi stagnation is the predominant factor, Korean hand therapy provides a simple and systematic approach to selecting appropriate hand therapy techniques. Using a range of simple hand therapy tools and techniques, these pathological factors can be addressed as part of the overall management of sports injuries and concussions. Time, a crucial factor in acute sports injuries. Why is time a crucial factor in acute sports injuries? Acute sports injuries are a major concern for athletes at both the professional and amateur levels. However, many people, including healthcare practitioners, are unaware of one very important factor: time. How important is time in determining the effectiveness of treatment for acute sports injuries and concussion? And what happens if we fail to improve an acute sports injury quickly? As I mentioned earlier, acute sports injuries result in significant blood stasis. According to hand therapy, this blood stasis tends to become more stubborn over time. As a result, the longer the treatment is delayed, the more difficult the condition may become to improve. A classic example is an acute ankle sprain. We often see people who fail to recover promptly from a sprained ankle later develop chronic ankle problems or even secondary issues affecting the knee or hip. In some cases, surgery may eventually be required. 2. The key to improving acute sports injuries and concussion. The key to improving acute sports injuries and concussion is early intervention. The sooner appropriate treatment is provided, the greater the opportunity for a faster recovery and a quicker return to normal activity. Korean hand therapy and the two causal factors and time factor. 1. Korean hand therapy and the two causal factors. Earlier, I explained the two main reasons why Korean hand therapy is so effective: the brain map and direct stimulation of the target area. These two features enable hand therapy to effectively address the two pathological factors identified in hand therapy theory, which are blood stasis and chi stagnation, and they are considered the primary factors underlying acute and chronic sports injuries, as well as concussion and post-concussion syndrome. 2. Korean hand therapy and the time factor. Another major strength of hand therapy is that it can be applied anytime and anywhere. All you need is a few simple tools that can easily be carried in a small case like the one shown here. Because hand therapy can be applied immediately after an injury occurs, it allows treatment to begin at the earliest possible stage. Early intervention provides the greatest opportunity for a faster recovery and a quicker return to training and competition. Summary. Taken together, these features make hand therapy a highly unique and practical approach for managing both acute and chronic sports injuries, as well as concussion and post-concussion syndrome. Now, let me share a few clinical cases that illustrate how hand therapy has been used in my practice. Sprained ankle. This athlete was a tennis player in New Zealand. I was able to see him immediately after the injury. According to hand therapy assessment, this was a very acute injury with predominant blood stasis and a small degree of chi stagnation. I applied two simple hand therapy techniques, and the treatment took about 20 minutes. During the session, he said, "My pain has dropped from 10 out of 10 to almost 0. After the treatment, he was able to continue playing tennis. Case 2, concussion. This was a very acute concussion. He slipped on an icy surface and struck his head heavily on the ground. According to hand therapy assessment, the condition showed predominant blood stasis. He was scheduled to deliver a 6-hour lecture later that day. I did the same brief hand therapy session, after which he saw a considerable reduction in his symptoms and was able to deliver the lecture. I repeated the treatment the following day and again on the third day. And after these 3 sessions, his symptoms had resolved and he hasn't reported any recurrence since. Case 4, chronic back pain. This guy had experienced low back pain for about 5 years following an injury. According to hand therapy assessment, the condition showed predominant chi stagnation with a smaller component of blood stasis. I selected the treatment techniques accordingly. He experienced significant improvement after the first session, and by the fourth session, his symptoms had improved substantially. Case 4, sciatica. This lady had experienced recurrent sciatica for about 30 years. Her symptoms extended from the low back through the buttock and down to the foot. According to hand therapy assessment, there was predominant blood stasis in the low back and buttock, with chi stagnation being more prominent along the remainder of the affected pathway. I provided 3 treatment sessions based on this assessment. After the third session, she said, "I am 99% better." She hasn't reported any ongoing symptoms since then. How do we use hand therapy to manage sports injuries and concussion? Hand therapy uses 4 main techniques: 2 invasive and 2 non-invasive. By applying simple principles to select the most appropriate techniques for each condition, hand therapy can be used to manage both acute and chronic sports injuries, as well as concussion and post-concussion syndrome. Korean hand therapy is surprisingly simple to learn. After just a few hours of online training, you will understand the core principles and be able to apply practical hand therapy techniques to help manage acute and chronic sports injuries as well as concussion. If you have any questions or would like to discuss online training for yourself or your team, please feel free to contact me at oawcenter@gmail.com. Thank you for watching. Goodbye.